of the doctor visits that every woman dreads, but it's your best defense against ovarian and cervical cancer, the Pap smear. Dr. Lila Schmidt from Alvarado Hospital is here to tell us how the exam has changed and to tell us also how long you can put off the appointment. Good morning, Lila.
Hi, nice to see you.
So tell us a little bit about why this is so important for women to do this regularly and how the guidelines have changed.
It's important that a woman see a gynecologist or infertility doc or her internal medicine doc to do her well woman exam. And a well woman exam consists of just not just the Pap smear. The Pap smear is a very small portion of a well woman exam. For me, example, even though I do all infertility, I do general gyne, and a Pap smear will include a neuro exam, a heart exam, a lung exam, kidney, liver, everything. But the Pap smear is what women remember because they don't like that part.
Right. But the annual exam really consists of a whole lot more than just that.
And that's my concern, is that the guidelines, the old guidelines before November 20th were a woman should have her first Pap smear within 2 years of having her first coitus or intercourse, or at the age of 21. Your screen says 20, but it was actually 21.
Okay.
The new current guidelines say every 3 years, starting at 3 years within first coitus or intercourse, or starting at 21, whichever comes first. So they're lengthening the time of period of when you need to start your Pap smears. And then it used to be every year from 21 on, and now they've lengthened that to every 2 years in your 20s and every 3 years in your 30s, and you can even stop them. So we're decreasing, the recommendation is to decrease the amount of Pap smears that women are getting, which sounds great because cervical cancer is slow growing. We know that. But since the Pap smear is not all of the annual exam, that bimanual exam is where you hate it. The doctor sticks a finger in a spot where you don't want it to be, and the other hand on the tummy. And also I do a vaginal probe ultrasound because I've picked up 3 ovarian cancers of infertility patients who wanted to get pregnant by my exam, which felt kind of odd, and then the ultrasound, I confirmed it. So not only did we get them babies eventually, we saved their lives.
Right.
And ovarian cancer is very rapidly growing, and so if a woman does not go in for 3 years, instead of catching her in stage 1 of ovarian cancer, which is life-saving, you'll catch her in stage 4 and she's dying.
And oftentimes people in general, men and women, avoid going to the doctor because they don't think there's anything wrong because they're not having any pain. But isn't this the sort of thing where you may not feel any pain, but there could be something drastically wrong if you're not getting that annual?
Exactly. I mean, I had a woman this week, she was diagnosed with chlamydia, no symptoms, no problems, and so it's important to come into the physician. I think patients are going to misread not getting a Pap smear with don't go see the doctor, and it's completely different, and it's going to cause savings of money in the short term, but a lot more money spent in the long term because we're going to miss things, we're going to catch them later in disease process.
Let's talk a little bit about what looks normal and what doesn't. You have some diagrams here to show us.
I do have some diagrams, and I try to explain to women because a lot of women don't know what a Pap smear is. And here is a person, is what I always say, it's me, cut in half, and so you can see that the uterus is where a womb or a baby develops, and the tubes come off of that, and then the ovaries. The cervix is actually just the opening of the uterine cavity. That's it. And so a Pap smear is when you take a Q-tip, you put a speculum in a woman's vagina so you can see, so I can see the cervix, and I always explain to them it looks like a nose only with one hole.
Okay.
And so I put a Q-tip on that cervix and take a sample of it. It'll cause some spotting because you want to get the cells. If you don't get the cells, the Pap smear will come back from the pathologist. No cells, can't read.
Okay.
So these are abnormal cervixes here. A normal cervix is just beautiful pink, and I know I'm sound weird because it says it's beautiful, but it has beautiful tissue. There's no white epithelium on it. There's no discharge like there would be in gonorrhea. And so you can pick some patients by classical cancer, just the way they look. Other patients will come back, and when you swab it, you're looking for abnormal cells as well as HPV. HPV is the correlation to cancer of the cervix.
And how common is that now?
Oh, it's terribly common, unfortunately, because women, they say, well, I'm not having sexual relationships with everybody or even just one person, but they're doing serial monogamy. So they'll have sex with one person for 6 weeks and then somebody else for 6 weeks, and they think they're being monogamous, but they're not. They're being exposed to everyone that they've had sex with, plus everyone they've been with. So cervical cancer and HPV are very common. It is true that cervical cancer is slow growing, but you need to see your physician every year And some women I have come in once a decade. It's not a decade test, it's
Right.
once a year.
And the information right there on the screen for Alvarado Hospital, if any of our viewers have not been in a decade, hopefully they have, but if they'd like to see you or another doctor for this test, they can do that.
They should.
Okay. Life-saving things. Thank you so much for being with us this morning. And for more information, you can go to san diego6.com. We'll be right back.